Really see the government spend is 1% of the GDP. Overall spend is 5.5%, reasonable. But with the commitment of the government taking the GDP spend from 1 to 3 over the next 5 years, does help from a quantum perspective and demonstrates the government's focus on the healthcare, which is good. Very welcome, and I think the next couple of 5-year plans should see a lot of money or investment going into the healthcare sector. If you look at the spend on the chronic disease treatments, and I want to focus your attention on the map on the right top. The entire population, almost 80% of the population today are being served by the private institutions. And the remaining 20% are really going by the government sector. Now, the investment by the government sector is huge from the NRHM, setup that they have created in terms of the sub-centers, the primary health centers, the CHCs, so on and so, district hospitals, so on and so forth. But again, the kind of services that are available to the larger population is still not benefiting from the investment they have made. They are still depending on the private segment, which is really burdened because they are serving almost 80%. Now, we all know that the PPP, or the purchasing power of a typical Indian, is increasing day by day. There are at least, I would say, 15 million folks today who have an equivalent of $100,000 or more in salaried income who can afford the best healthcare today. They can go outside India if they want to. They would not, because actually the healthcare is flowing into India, so they can go to the best of hospitals and get treated over there. So that segment is increasing. The other anomaly in the entire system, if you really look at it, is there's a lot of out-of-pocket spend, which is again hurting. You see, for every treatment that an individual or a family goes through, almost 70% of that spend comes from out-of-pocket. That has to be changed. So we have, essentially, if you look at it, two big gaps in a nutshell. One is the private segment or the private healthcare service providers are overburdened, and they need to use some mechanism to drive only that traffic which needs to come to them, right? The statistics, at least from the group that I have been associated with this Fortis, 80% of the people who come to an emergency need not really come to an emergency. They can be actually treated without coming to an emergency care. They just come there because they have no other ways to be aware of where to go. They hardly tap the primary or the secondary care, and they directly run to the tertiary, because in case of need, they get there. So that is where I want to add the third A in what Jagriti actually mentioned. She talked about accessibility and affordability as being the two key areas to be addressed in the entire segment. I think awareness is the primary one, and that's where healthcare education, sir, is so important, because that enables the right behavior for the population in need to go to the right place and get treated, right? Rather than waiting for the last minute and then having no other option but to go miles, travel to a tertiary care or to a private hospital, because there is hardly enough time for any of the prognosis or diagnosis being done upfront. Whatever said and done, even though the government has invested huge amounts in their NRHM schemes, and I think the system that they have created all across the country is very good in terms of creating that infrastructure of PHCs, CSCs, and tying them all together from an infrastructure perspective. But I think that's not so effective because the facilities are poor. You don't have the right doctors, the nurses, or the paramedics that are needed to make them effective. If we just provide IT systems who can leverage that setup all across the country, and likewise in Gujarat, you can see a huge improvement, and the population slowly moving from the dependency on the private, moving into the government segment. And that will be beneficial for the population in general. It will ease their out-of-pocket expense, because government services are generally cheaper, inexpensive, and you can get treated a lot easier rather than going into debt. There's 1 million families who go into debt every year, almost to the stage of suicide, because of the burden that they inflict on themselves just by one major disease in the family of a typical 5 or 6 people member. One member in the family falls sick, and the entire family is indebted for generation. Right? So those are the kind of stats which are very disturbing. But fortunately, there is a way out of it, and that's all about the integrated healthcare delivery system that we'll talk about. So now let us focus a little bit on what are the probable solutions going forward for it. Now, if you really see, we have to have some kind of a common thing that will link all these individual initiatives together, or all these problems together. There is a problem of awareness, there is a problem of accessibility, and there's a problem of affordability. How do you bridge this in an integrated manner? ICT, IT, communication, all these things can easily come to the rescue, and we've seen this happen in various other segments. We've seen it in telecom. Telecom, 15 years back, we knew what was the price of a mobile phone or a satellite phone and how much we paid. Today, the reach of a mobile phone, what has it done? All because of an IT system behind it. Similarly, you look at financial services. Where was financial services? How many of us really had to go to the bank every week, if not more, just to transact? And today, I bet you, no one in this room probably visits their bank more than once a quarter. That also to just assure themselves for some special services that you are not comfortable doing over the web or your mobile or through a relationship manager. So those are the kind of things which have been proven in other industry segments, which can easily be brought to healthcare. Now, healthcare has some unique features which are different than other industry segments, whether it's travel, telecom, financial services. And because here you're dealing with human lives, you have to provide the right service at the right time, and it can make a difference in somebody's health, somebody's life and death kind of a scenario. So the systems have to be more reliable. They cannot be a trial and error. They have to meet the exact need. They cannot be paper solutions. They have to take a lot of ingredients into mind before you deploy such a solution, right? There should be adaptability in that solution. If you put a solution which the doctors, as was mentioned earlier, doctors are the key. If doctors don't endorse the solution, that solution is no good. It is not the West, right? In India, doctors play a major role. So whatever systems and solutions you build have to be first endorsed by the doctors. They have to buy into it. Only then you will see a success for those kind of solutions. Now, when I talk about electronic health record, it's not the generic definition of an EHR, EMR, or PHR, or whatever. It is more just to create a data set or a combination of data, which just keeps your history of medical record with it. And it can be at any level. You can keep it on the web. You can keep it in a system, in an HMIS. You can keep it with a hospital or a doctor where you have been. You can keep it at a district level. Doesn't matter. But just think about EHR as something which documents electronically your health record from the time you start using healthcare services in the country or in the state. Right? If you do that, you can then build systems which leverage this and can eliminate a lot of touch point, lot of repeatability, lot of unpredictability in the kind of solutions that you deliver to the patients. Telediagnostics and diagnosis or remote monitoring. You can do all of that. We have the technology, the bandwidth, the communication, the systems today, which can take away the accessibility out of it. You do not have to force doctors to really move from tier 1 cities or tier 2 cities into the village level. You need just technicians who can be at the village level on a PHC or a CHC. They can then do telemedicine to be able to get the same amount of care and help as you would do in a person-to-person interaction. My thinking is, and there are no stats on this, but my thinking is, generally when you go to a doctor, what happens? It is all communication, right? The doctor really talks to you, takes your vitals, either by touch, feel, talking to you, a past history, a family background. It's all communication, right? That doesn't really need a face-to-face interaction. It can happen over the phone. It can happen to an EMR, which already has that data. So 80%, I believe, 75 to 80% is communication, and only the last 15, 20, 25% is actual diagnosis and prognosis, which the doctor has to be involved in. We cannot take that away. You can build expert systems over there, but you can pretty much take care of the 75-80% through IT systems. In order to enable that mindset, you need awareness. And awareness can only happen at a very grand scale where you provide free services, use the web, use the mobile, use telemedicine, and all those things put together to be able to enable or basically empower the patient to really learn more about it. I'm sure we all know, before we go to a doctor, after we come back from a consulting appointment, we all go to the web. We are, at least the affluent, the urban folks, are very familiar with what type of disease they have, what they are going for. And I have heard doctors say their jobs are becoming more challenging because sometimes the patient knows equally well about what they have come for. They would ask questions, why are you giving me this medicine? What are the side effects of this medicine? So on and so forth. So I think that is where this awareness is becoming very important. You can go into virtual doctor monitoring. Once you have the EMR kind of scenario, there is nothing stopping a hospital or a doctor to provide care at your home. They can call you up. They can have remote monitoring devices to understand the state of your recovery, your post-operative, how you're feeling about that, and over the phone or over a call, give you the next steps without having you to travel back to that center. Benefits are dual. First of all, you're not blocking the time of that key doctor, which we know is a major resource crunch in the country. You are utilizing his time to really advise, diagnose, and prognosis for the new customers, new patients, right? And the rest of it can be done through protocols, algorithm-based systems, a lot of IT-based systems, which are equally good if you can build the right awareness around using it. But it's essential to connect all these dots together. If you really look at a solution, for example, I say I want to reduce the IMR in the state. And you will start certain schemes in that. Now, unless the entire ecosystem is connected, it will give you benefits. It will help you reduce the IMR, but it will not go beyond a certain point. Right? What I mean by connectivity is you have to connect the PHCs with the CSCs, with the tertiary, with the private, so that this ecosystem seamlessly can flow without any boundaries. And that is where you will really utilize the entire resource pool of the healthcare ecosystem. Let me take some practical examples. And here, this is not a marketing or a sales pitch. But as I said, I will take examples from what is with HealthFore. Now, one of the things that can be a very effective integrated healthcare delivery mechanism is through an HMIS. HMIS is nothing but a healthcare management information system, which you typically install in a hospital, which connects the various departments, flows at various levels together so that you are really taking out the manual intervention, the unpredictability, and you can basically optimize the entire flow, whether it's a pathway, whether it is the care provided to the end customer. Now, our product is called Magnum. It's an end-to-end integrated healthcare system, HMIS. When I say an integrated system, it has the financial backend. It has entire clinical and administrative modules. So when you talk about hospital administration, it will have connectivity to the stores. It will have HR management. It will have facility management, asset management that you have to do in the hospital. Patient management, it would have the entire patient billing modules. It would have pharmacy, drug formulation, it will have emergency and ambulatory care modules, and it will also have all your clinical support systems, interfaces to your pathology, interface to your radiology. All those things come under one umbrella in a single system. What you have to be careful is not go for what is available. Go for what is needed in your hospital or your nursing home, just the bare minimum. It is an evolution. If you try and do too much with the system and try and get the best of breed, there is an investment attached with it, right? Even though there are hospitals who would go and buy the entire system and they barely use 10%, 50% of the system. That is not as good as you buy something small, get to a stage where you increase adaptability of that system, see the benefits of the system, and then take it to the next level, scale it up, add more modules so that there is conviction in the entire system, adaptability. The biggest challenge is getting the doctors to adopt it. Right? Will they start prescribing and creating EMRs for every patient they see? They may not be doing it. Their help may be doing it, whether a paramedic or a nurse will do it. Right? But unless they do that, the entire system will just be islands of modules functioning in a dysfunctional way. So it is very important to really make an effort to focus on adapting a system, making sure that it is only meeting the basic needs that you want to do and take it on a step-by-step basis. Magnum has a PACS module. It has a kiosk. Kiosk is you can place it anywhere in the hospital. Patients as well as doctors can have access to it to get some vitals, right? How is the patient doing? Is there an intervention required? Patient can look at their doctor's schedules. They can look at, when is the next visit going to be? What is his background? Things like that. You have an ICU monitor module. Tracks all the vitals of patients in the ICU, right? You don't have to continuously monitor a patient sitting in front of him. You can take all that out, let a system take care of it. Anything which goes outside bonds, signals are red, right, on the screen. It sends an SMS. It sends a text message. It can even call a doctor and for intervention. Those things are there in every HMIS today. I mean, medium and tier 1 and tier 2 HMIS, they are all there. Technology is existing. Adaptation and making sure that you get it right is the key. There's a Magnum portal. Magnum portal is more of a dashboard, which is again accessible to patients and doctors alike to monitor the entire thing. They can see their billing. They can see when they're going to get released, what are the discharge procedures, what are the post-operative care they need. They can watch videos about learning about what they are going through. It can also serve as an information device to watch TV and other things if they want to in their rooms and other things. So, and then you need an interface layer, which in Magnum is the X-Trans EDI, which really connects all these modules through the standards and protocols that fortunately are already existing in healthcare, which are the HL7, the HIPAA compliance, and all the JCI and those kind of things. So in a nutshell, the systems take in all the process rigor and build a workflow and a process mechanism within the system to take care of the day-to-day routine activities. You go for a cabbage. The system, if you have defined it right, will tell you, I don't know the full form of cabbage, but it's something to do with the heart procedure, and it's a package. It will tell you what all needs to be there at the doctor's operating table for doing that, what is the preparation to be there, what all tests are needed prior to getting into the cabbage procedure, what all vitals need to be stabilized before you do that procedure, what is the procedure needs to be performed, how does he come out of it, what are the post-operative procedures, what are the tests needed, at what frequency after that. All that is part of something which is inbuilt in the system. You don't have to remember it, you don't have to start it manually and things like that. So these systems, I believe, are a very good example of an integrated healthcare delivery system in healthcare, which one should look at and adopt. The other set of services that we provide is on the consulting side. Now, there are a lot of healthcare delivery organizations or provider organizations which already have systems in place, but they may not be integrated. They could be, they want a new asset management system, right? So as a consulting assignment, you could go in there, understand how much leakage, revenue leakage, patients per bed, the things like that are needed to be able to focus just on that element and add that as part of it. You can go in and help out with operationally making the existing processes more efficient. Look at the root cause. Do a Six Sigma on existing providers. What is lacking there? Does it need investment in terms of infrastructure? Does it need manpower? Does it need better processes? Does it need a new HMIS? Does it need M-Health solution? Does it need education? All those things can help in terms of providing, and that is where we have a division focusing on that. I think the most interesting part, those things are more conventional, traditional, existing, been there, and that's a matter of time when they get adopted. I think the interesting thing that is happening is on the M-Health and the information management services side, which is what is really taking on the leading edge, innovative solutions and services and bringing it along with the traditional services. Here, we have 3 products right now. And I just want to touch upon each one of them briefly and then see how, if I can correlate the benefits of what they deliver. Healthline 24/7 is a simple health information hotline in a very basic terms. It is a 24/7 platform which provides information on diseases, medicines, providers of 15, 20 kinds, whether it's a hospital, a chemist, a physio, a laboratory, a radiology lab, whatever it is, which is the closest one you can go to, and puts all that in a very effective search, compare, evaluate, and select model. So you want to find out a doctor or a hospital which treats certain symptoms. You go to the website or you can call, and they will help you identify these symptoms mean you need this kind of specialist. This specialist, these are the list of specialists that are available in your town, neighborhood, country, city, wherever. Pick one based on your criteria. What is your paying capacity? Do they make home visits? Do they take credit cards? What is the background of the doctor? So it's a much more detailed information portal to help you select the right doctor. Healthline 24/7 can also assist you in making an appointment with a doctor. And when you say appointment, it's not just an SMS. It actually taps into the doctor's or the hospital system. That's where the integration comes in, and actually marks his calendar with your details, providing the symptoms that you have discussed on the call or put on the web. So the doctor, when he goes for the appointment, knows that these are the few things that I need to know even before the patient comes and sees me. There can be reminder services back to the patient to ensure that he is, in fact, making the appointment. And if he is not, then doctor's time needs to be freed up. Otherwise, he'll be wasting a 20-minute or a 30-minute of his time waiting for a patient which never turns up. So there are a lot of things in this, and it's only information. There is no diagnosis. It only helps you become aware of your problems, your symptoms, helps you select or understand the medicine. It has alternate medicines. It has, so it's that kind of thing. The second is Mediphone. Mediphone is taking and using ICT to provide advice over the phone. As simple as that. A person calls, a doctor answers, based on a conversation which can last anywhere from 5 minutes to 8 minutes, 10 minutes, will prescribe some medicines which are generic, over-the-counter medicines, but at the same time will help you understand whether this is a serious problem. Does he need to go to an emergency? Can he wait till tomorrow to go and see a doctor? If these medicines, what he's prescribing, does not help, what should he do? Or does he need immediate help? These symptoms seriously mean that he's going to, just needs an ambulance right away. Coordinating all that is, we have launched it as a premium service with a private provider, Airtel, right now, and we are running it across 8 states. We will take it pan-India on a single number by the end of the year. So I think these kind of services help eliminate some of the burden which typically in India, in the rural areas, they face of where to go. Should they go to a quack which is in the village? For much less money, they can get a doctor's advice who's sitting in an mHealth clinic center somewhere in Delhi and following a very rigorous set of protocols to answer these calls. The protocol that we are using behind this is by Medibank, a company which has been providing these services for the past 13, 14 years all across Australia. So those are the kind of systems that we want to introduce in the country and bridge the healthcare gap. The same thing can be taken as a 104 service to the states, right? So there is no reason why the same service without any changes, other than the government funding it per call, can be implemented in Gujarat. The same thing was the 104 service, HMRI in AP. It's all the same. And more states, I have seen at least 6 tenders come in the last 6 weeks where they want to implement this. Perfect platform to bridge the healthcare divide and to really introduce integrated solutions in this space. Telemedicine. Again, I think this, again, being a large word, but telemedicine can mean different things. It is remote monitoring. It is chronic disease management. It is getting to the customer's home or a single point of presence in some remote area and then providing the connectivity either by video, phone, medical devices to get his vitals, move it to the tertiary center, evaluate it, and then provide the service. Now, the key thing is if you combine these three. Just imagine the power of what these three segregated, integrated systems can mean if you combine them and have a common EMR around it. And then have all the hospital systems, all the diagnostic centers, all the radiology labs, all those things working in a community. Just an example. You call for Mediphone for a help. You get medicines. You immediately get transferred to Healthline. You can find out what are the side effects of the medicines. Can you get a cheaper drug for the same formulation? Is there some precautions you need to take for it? Can you chat with somebody who has had the same problem and what are his experiences? You can find out about the doctor who gave you that prescription by his MCI number, so on and so forth. And can you then schedule a telemedicine call, which is closest to you, to actually take advice if your conditions deteriorates? So those are the kind of systems which are essentially required to take us forward in the vision that we have for the country in getting to a level where we are more aware, we provide more affordable healthcare, and healthcare is accessible to everybody. I'll speed up a little bit. Now, if you really see what we are trying to do is, IT is always called as an enabler. Moving from an enabler, we want to take it to the next level and make it a driver. Right? In the case of healthcare, I believe things like service delivery, communication, information management have to move to the next level. They cannot only be considered as enablers. Enablers will get you to a certain extent. But if you make them the drivers for healthcare, you can achieve a lot more. Right? So there's a subtle difference, and that is where you can build this ecosystem which really enables you to bridge the gap or take the objective to realize your dreams. Coming to a key feature that is needed in any integrated healthcare system. When you are delivering a healthcare system, what do you need? You need interoperability. Whichever conferences you attend, there's always a dozen ecosystem stakeholders which are talked about should be interoperable. And thankfully, there are enough systems, processes, standards, guidelines available to make them work seamlessly. Today, a hospital, a laboratory, a PHR, an application provider, physician, they can all interoperate sitting in a brick and mortar kind of a scenario. No questions about that. Most of the private institutes have this. They are always taking it to the next level. The change we are seeing, or the paradigm we are seeing, is each of these stakeholders are now becoming mobile. Right? So whatever you used to do by sitting on a laptop or a desktop in a hospital can now be seen on a smartphone, can now be taking you forward and be done by a telephone, by a cell phone, by a PDA, by an iPad, all those things. Think about that happening all across. A doctor, when he starts from his home, can see the appointments in his card, see which patients he's seeing, what he needs to know about their background, and do his job much more effectively, even before he takes his first consultation when he reaches the hospital. The real change which is happening now is when it's okay that we have all this interoperability, but look at it putting the patient in the center. And let every other stakeholder work keeping in mind the patient in the center. Right? Whether it is metadata, whether it's e-commerce, whether it is legacy or mainframe applications, customer service, CRM, and that is what is giving ground to a new concept called Universal Connect. Everybody is now connecting to the patient because ultimately healthcare is nothing but providing that extra access or care in a continuum manner to the end patient. How do you achieve that continuum is the key. Today it happens by discrete visits, discrete affordability of the person's ability to do it, or his awareness to do it. This ecosystem of integrated healthcare can bring all that together and make it possible of a universal connect. The other thing I think is just worth mentioning is there are a lot of systems which look at information systems, which drive communication system. There is a lot of interaction-based solutions which are driven by IS, right? And examples are there in front of you. There are a lot of transaction systems. Again, you can drive them through the management system. There are a lot of integrated solutions driven by decision support system, DSS, right? I think the maturity will come, and this is again a concept of integrating everything together. If you combine them and get to an expert system. An expert system is nothing but it is an intelligent, cross-platform, universal connect kind of an ecosystem where you bring in the decision support system, the management system, the information systems, communication systems, all together on one umbrella.